Hey, here we are, Friday, 12:30, doing some basic body foundations and enjoying time with you. Hope you're enjoying time with me too. First of all, I just wanted to ask, what is it that you want to see? I'm just sort of putting things together, doing some stretches, a little bit of education. That's also why I created that group that you're a part of. Hopefully, if not, sign up. I'm talking about the Get Control Facebook group. So I want to share as much knowledge as I can with you. And again, that's why I'm posing the question, what is it that you want to see, and how can I help you get more control in your life, not only with your body, but also your mind, your emotions, and spiritually too? Um, yeah, so I'd like to get control of this heat because it is crazy. Our house was 30 degrees Celsius yesterday, and it was just a lot. It was almost too much for us. I don't think it cooled off until like 7 p.m. or so yesterday. Um, but that's okay. I mean, it just is what it is. And the unfortunate part of that is it's June, um, and starting after Mother's Day, the bugs have been brutal. And I feel like my um, uh, sympathetic nervous system has been on full alert now that the bugs are here. I keep thinking that they're just going to eat me alive. Not interested. Hate the bugs. But here we are, living in a northeast Ontario. Here we are. What else? Well, I think some of you have seen too. I'm just going to chat a little bit while we wait for a few people to come. But I got engaged. So exciting. So maybe you saw my post about that. But yeah, Sean asked me while we were in Montreal, and it was very sweet. And he said a lot of wonderful things to me, and I didn't even know was coming. And now here we are. So 40 years old. It's been pretty surreal and pretty exciting, to say the least. So yeah, so that's why I have been super all over the place the last few weeks, super busy trying to get all of that coordinated. We are trying to have a ceremony within the next 4 months, so lots to do. And truthfully, I was quite excited to start doing all of that, planning and everything too. So yeah, so it's exciting news. So thank you to you and everyone else who has sent some sort of congratulations. Appreciate that. Sean does too. So I read them all, responded to them all because I think that is important, and I want to make sure you feel just as important for making me feel good. So there you go. So here we are in my little space. We're going to talk about and do some stretches to help relieve digestive issues and symptoms, as well as IBS symptoms. So we are going to start with our usual neck stretches. So choose a hand, any hand. I'm going to choose my right. I'm going to put that just like that underneath my bum, and I'm going to pull my head gently to the side. And that's going to give you a nice stretch here. Sorry if there's some noise. We've got some construction going on. We are replacing our windows that were installed incorrectly. We've been dealing with that drama for a very long time. Anyway, don't need to talk about it right now. We are trying to relax, do some deep breathing, do some stretches, and stretch your neck. So relax. You can reset, hand underneath your bum, and you're going to bring not only your head to the side, but you're going to bring your head to forward, and that's going to help relax that that posterior neck muscle there. So why we do the neck stretches for IBS? When we feel anxious, which is a symptom of IBS, and it creates IBS, we tend to only breathe from here up, and the muscles in our neck get really tight. So that's why it's important to stretch the neck if you're ever feeling any digestive issue or anxiety. So reset, and we're going to go to the side and to the back this time. So that'll stretch the front of the neck. So yeah, when you're feeling anxious, which is usually contributing factor of IBS, a lot of the energy gets trapped in and around this area, so from the shoulders up, because we do that when we feel anxious, and that clamps off the digestive system too. So IBS and anxiety go hand in hand. So if you've ever been an anxious person, IBS is probably the name of the game with you too. When we are feeling grounded, it means that our digestive system is working properly. Lots of explanations for that. I could get into even more, but I don't want to get too deep into this because we're just stretching and enjoying each other's company. So you're going to take the other hand, palm down, you're going to sit on top of the hand, and you're going to pull, and that's going to give you a nice stretch here on the neck, the middle of the neck. IBS is cramping in the digestive system, and that can be anywhere from the stomach, the pancreas, gallbladder, and liver, small intestine, large intestine, rectum, anus, pretty much any area of the digestive system. And so yeah, lots of cramping. It is a combo between diarrhea and constipation. There's an emotional component, so social pressures. You have social pressure around going to the washroom. You don't want to go when there's people around. That can contribute to IBS, irritable bowel syndrome, because that stops the normal flow of the bowels. And yeah, fascial restrictions can happen too, so that's a physical component. And there's a mental component to the fascia as well. So when there is fear, you're worried about something, again, the energy goes up to the head, but then there's also can be a tightening of the fascia in any of those digestive organs. Fascia is a connective tissue, so it is connective tissue that goes from the head to the toes. I call it a onesie. And if there's a tightening on one area of the fascia, then there will be a pulling on other areas of the fascia too. So it's very much like a t-shirt. So if you pull your t-shirt, then other areas of the shirt are going to get pulled as well. So if I pull here, you see the whole shirt comes up. So it's very much the same principle. So the fascia is over top of all of the muscles. It's even around the mesentery, which is the fascia around the abdomen. It's connective tissue on top of every muscle and muscle fiber as well too. So it's a pretty impactful connective tissue. A lot of emotions get trapped in there, so I still have to do a little bit more research on that. But yeah, it seems like when you're emotionally distraught, or there's a big emotion or a mental fear, the fascia tightens and it acts like a protective mechanism. Even if you don't really want it to be a protective mechanism, it's just an instinctual thing that happens. So especially with IBS, if you're feeling overwhelmed or fearful, then the fascia will be tight around anywhere from sort of here to here. And so this gets really tight, and then it's hard to digest food, so then you need supplements like HCl for your stomach acid, and you get more bloating and cramping because this is all tight and there's not that flow and openness and movement to utilize all of your digestive organs. So that's what I think IBS is. I'm sure other people have different criterion and definitions around it. I've had it my whole life. I kind of just self-diagnosed, but it was everything that I described. And so now that I've been doing more deep breathing, opening up this area of my body, as well as doing, like we talked about last week, power pose, um, that helps to open up the solar plexus, helping you to feel more confident and digest food a lot better too. So the neck is important, like I say, because when we get anxious, all of this gets really tight up here, and then we get no circulation here or here. So the neck needs to be opened up as well as the abdomen. So we did the neck stretches. I want to do just a little bit of tricep stretches. That helps to bring the shoulders back and down. So just lifting your arm up and then using your other hand to pull back your arm just very gently and slightly. And so that helps to open up that arm and that shoulder so that you're able to open up your digestive system even more. You want to elongate all of this. The liver is here, the gallbladder's here, pancreas and stomach. So you want to be able to open all of that up along with the bowels and the small intestines too. So doing this tricep stretch, it also helps to get that subscap, which is just under that scapula muscle. But that helps to open everything up too. So again, you want to hold for 15 to 30 seconds, and you want to open all of that up. You can even do a stretch over just like this too. That helps to open everything up as well. But I think the tricep and the subscap is a great stretch to do. So now we want to do the other side. If you feel like it's really hard to do, just go to where you can. Maybe your range of motion is here. Don't ever force a stretch. We want to be nice and comfortable and do some deep breathing so that you are comfortable, so that you can hold that stretch. I can definitely tell this one's a lot tighter on me than the other one. So you'll probably have one side that's easier to do than the other. So remember, hold 15 to 30 seconds. This helps to open up that side and that area. So this will open up the stomach and the pancreas. This side will help to open more of the gallbladder, liver. So you want to do that. Arm circles, just like we did last week, is a really good idea too. That helps to open everything up. Open up that solar plexus. We want it all open as much as possible. We want to get out of this position and get into this position. So even last week that we did frozen shoulder, you want to be able to bring your arm out, open, and open all of this up too. So everything works together when you work physically on a certain area. It helps to open up other areas too. Next stretch I want to do is a twist. So we want to twist at the waist. These ones are really good. I see a lot of yoga instructors doing it too. So put one leg straight and then the other leg over top of that leg, like this. And the leg that's over top, you're going to twist towards that spot. And if you want to make the stretch even better for yourself, you can hook your elbow here and then pull. I guess you're pushing with your elbow and pulling at the same time. Good. Another thing with IBS is a lot of times when we eat things that create inflammation in our digestive system, it seems to turn the nerves off. So I've heard something called neurogenic bowel, and I believe that's probably what I had as a kid. Let's do the other side. And I couldn't feel, so straighten your other leg, and then bring your other one over, and then hook, and then rotate. But I couldn't feel the nerves in my pelvic floor, I guess. I mean, as a kid, you don't really know that, but I wasn't promoting peristalsis because I couldn't feel the nerves. So that's an issue for sure with people who have IBS. And so the more you're able to bring awareness and mind-body connection to the area of your bowels and your digestive system, the better and faster your healing is going to be from IBS. So if you can't feel your hips moving up like that, or you can't do that because there's so much inflammation here, you're getting hyperlordotic curves in your back, which is like an exaggerated curve in your back, then you probably won't be able to feel those nerves in your digestive system. And that's super important because we need the nerves to get to the bowels and the digestive system to be able to move things along. So if you're tight in that row, liver, gallbladder, pancreas, stomach, even spleen, then you won't really be able to digest things properly. So that's why we're opening all of this up. We're doing some belly breathing, deep breathing. I mean, that's something that I teach my coaching clients too when they're dealing with IBS symptoms, is we need to bring awareness and mind-body connection to that area. And what has helped me in the past is watching what I eat, and if there's anything that causes inflammation, I have an awareness around that food, and if I realize that I've been eating too much of it lately, I cut that out. So it's actually quite simple. I mean, it's not easy necessarily because we all develop these signals or needs or desires for certain foods that create inflammation. A lot of the times it's a gut bacteria imbalance, and so our gut bacteria is actually making us crave certain things. So I have a whole bunch of supplements for that from Bioptimizer. So that's a brain-body connection company that makes things for leaky gut, makes magnesium to help you sleep and to digest and relax, and to take cortisol out of your bloodstream too, and out of your stomach and sides here. Well, that's if you're feeling anxious a lot. Those people typically hold weight here and here. I mean, I'm one of them. But that's okay, we're working on it. Yeah, as I talk, I'll do another stretch. So I'm going to do the hip stretches, so figure 4. I've done this one before, but I'm just going to do that on the bench over here. So you're just going to sit down, you're going to put one leg on top of the other, and you're going to push down. And that, you should feel a tightness release on the upper thigh here, so around your greater trochanter where all your glute muscles attach, and even the hip flexor here on top of the leg. So this will help to bring more openness to your digestive system and your abdomen. So doing these things that we're talking about now, doing them consistently will guarantee that your IBS will start to get a lot better. Couple that with having the body awareness of what causes inflammation in your digestive system and not eating those things, at least for now, will also help to relieve the IBS symptoms like cramping, bloating, digestive discomforts, socially awkward gas that happens too. So pull your leg up this way now, so you should feel that in the glutes. Yeah, I remember mentioning this before. I have a Twitter video, on Twitter, it's on Instagram and Facebook too, but it got a lot of views on not Twitter, sorry, TikTok. Lots of views on TikTok, 170,000 or something. So that's to remove any flat bum syndrome that you can get from sitting a lot. So let's do the other one. Switching over, pushing down. So again, you should feel that on the side of your leg where the bone is, the greater trochanter. So the greater trochanter is where all the glute muscles, all the rotator glute muscles attach, including the glute max. So stretching that out will help to relax your glutes, but it'll actually help you to remove that cellulite that's there. The cellulite is just tight fascia that's dimpled and stuck to the muscle. So the more range of motion, the more fluidity you have with joints, the less cellulite you will have as well too. Pull up here. There you go. Ooh, that's a good one. I like that one. I definitely have been sitting more lately. I felt like I've been a prisoner of my own home, especially now that there's bugs. So I've been sitting a lot more, so I definitely need to do this stretch more often. I mean, I use my fascial tools and all those things, but stretching really does have a lot of good benefits to it. So thank you for being a part of my basic body foundation, stretching. So that was part one. A couple of easy breezy stretches that you can do to open up the hips, open up the solar plexus, open up the shoulders, and relax the neck. So all of that will have an impact on your IBS. So it'll help you to go to the washroom more regularly. There are obviously other things that you can do too. I mean, I eat fruit in the morning. It's the only thing I eat from when I wake up to noon, lunchtime. And so that really has a beneficial, just a benefit to my digestive system and making sure everything moves through. Because if you can't move things through, then you can't lose weight, and we all want to be lean, right? We all want a fully functioning body as much as possible, and there's a lot of info out there, but I'll tell you, I've been using all this stuff for a long time, and it's working. So you can follow me along, continue on with that. If you have any more questions, let me know. Again, we're going to do part 2 next week, and that's going to include the strengthening exercises to do to make these stretches stick and help to create that posture that you need to help with all of the IBS symptoms and get your digestive system moving along regularly, so you don't have to think about that all the time. So when you have IBS and you have all those yucky symptoms, it's overwhelming, it's emotionally exhausting, it's physically exhausting, all the things. So there you go. So stretch your neck like we normally do, stretch your triceps and your subscap, do the twisting, and then stretch your hips. And then next week we will do the strengthening. And thanks for listening to all my stories. I'll talk to you soon. Bye.